Hello, I'm René Assink. I'm osteopath, I'm physiotherapist and health practitioner from Germany. I'm also a teacher for the Upledger and Boral Institute, also for the pediatric classes. This video is for the people who will want to come next year to the Visceral Approach to Paediatrics in October in Ireland, who already did the CST pediatric class, and to show what benefit they could have from this class. So if we see what you learned in the CST class in a very, very simple way, we teach the 10-step protocol for children. We do the energy cyst and we do the somato-emotional release. And of course, if we do a visceral class, we treat the single visceral organs. We treat them on a structural level. We treat them on a functional level and also on an emotional level. And thereby, in these approaches might be a little bit different. So if we see the body of a human being and also the body of a baby or a child, we have two axes, one dorsal or posterior axis and one anterior. And the dorsal axis is what we treat in the craniosacral therapy, where we treat the dura. If we treat the visceral axis, those more anterior, we have an axis that goes from the spheno-basilar joint going over the face, over the chest, abdomen, into the urogenital system. And especially during development, you have a very strong opening of the body going from a more flexion to more extension, especially the freedom to move for the organs is there, very, very important. If you see what we do in craniosacral therapy, we do the diaphragms when we're on the organ, of course. And if we see it on the visceral level, we do the spaces in between. So it's not always easy to treat an organ by a child because everything is smaller and sometimes more difficult to catch. So we decided to first treat the space, so the space between the diaphragms and the space where the organs are inside. And then from this more local, of more global, going to more local, treating the single organs, then to see what is possible over there and to see what restrictions do we have. And that could be a huge gain for when you already work with craniosacral therapy. On a neurovegetative point of view, you see if you have a disturbance over there, you have the axis between the brain and the vagus nerve and also the intestine. We also treat the brain as an organ. And if we have any dysregulations or any diminished movements over there, these have a huge impact on the development of a child, on a sensory way, motoric way, but also on an emotional way. So yeah, we have a lot of new material that fits perfect together with the craniosacral therapy. And yeah, I developed this to do it this way together with a person also from Germany, Barbara Feller, and we hope to come together to Ireland next year. Hope to see you over there. Bye-bye.